This is a demonstration for newborn examination and screening. Before we begin, we must check the activity of the baby overall, whether the baby is moving all four limbs with good tone of both upper and lower limbs. How's the size of the baby, whether the baby is small or big, appropriate for gestational age. If there's any obvious skin mark or dysmorphism on the face, you shall comment here too. Before we begin with the examination, it's important that we maintain good hand hygiene. Newborn examination is typically done from head to toe. We start off with the head. Lift the baby up gently. Rub your hand across the scalp of the baby. Feel for any scalp swelling, such as cephalohematoma, caput succedaneum, or any swelling that may suggest a subgaleal hematoma. Feel and look for the sutures and the fontanelle, especially the anterior fontanelle. Next, we move to the face. You shall also comment if there's any obvious dysmorphic features. Examine the eyes, the nose, and bilateral ears. Also pay attention if there's any preauricular skin tag. Next, we move down to the mouth and lip. Look for any cleft lip. And when we inspect the oral cavity, look at the tongue. You may examine for any tongue tie. Look for any natal tooth. And insert your finger gently and feel the palate from hard to soft palate, okay, to ensure that there's no cleft palate, isolated cleft palate. Moving down to the neck, examine for any swelling. Next, it would be the upper limbs. Check for the symmetry of bilateral upper limbs. Examine the proportion of the proximal to the distal segment. When we reach the hand, look for any swelling of the peripheries and pay close attention to individual digits and the fingernails. Repeat on the other side. Next would be the chest. Look for any obvious deformity. Examine the nipple for any abnormal size or widely spaced nipple. You should examine the respiratory and the cardiovascular system just like how you would in older children. Next, we move on to the abdomen. Examine for any abnormal skin changes, any prominent veins. Palpate the abdomen gently to feel for any mass, especially hepatosplenomegaly and blottable kidney. At the center of the abdomen will be the umbilicus. Look for the skin surrounding the umbilicus for any signs of infections, i.e. omphalitis. Also look for any skin defect around the umbilicus. Pay a close attention to the umbilical cord and identify 2 umbilical arteries and 1 umbilical vein. Next, moving on to the pelvic region. There are a number of things to examine at the pelvic region. We start by inspecting for the symmetry of skin creases. In conditions such as developmental dysplasia of the hip, there may be asymmetry, skin creases. Feel for the femoral pulse and ensure that you have good femoral pulse bilaterally. Pay close attention to the inguinal area and the scrotal area for any inguinal scrotal hernia. And examine the genitalia closely for both male and female. If there is any ambiguity, immediately inform a more experienced doctor. In the male genitalia, it's important to examine the shaft of the penis and the scrotal skin for rugate externally, and be sure to feel the testis bilaterally. Next would be the hip examination to detect or to screen for developmental dysplasia of the hip or unstable hip. This is done by performing bellow and autonomy maneuvers. First, flex both hip joint and the knee joint. Place your fingers on the greater trochanter of the femur bilaterally and push the hip joint backward. This is bellow test. And to do autonomy, simply abduct the hip joint. Next, do not forget to examine the anus closely, and this is not enough to just merely looking from far, but rather place close attention that the anus is patent. In some center, a soft catheter such as Rouse tube is inserted gently and into the opening for about 1 centimeter to ensure that the anus truly remain patent. Next would be the lower limb. Just like the upper limb, we examine for symmetry of bilateral lower limbs, any abnormal proportion between the proximal and distal segment, and examine each individual toes and all the toenails individually. Comment if there's any swelling on the feet. Next, we turn the baby to the back. First, again from head to toe, start from the neck for any normal web neck. Feel the spine gently for any abnormal curvature, and place close attention to the lumbosacral area, especially for any evidence of spinal bifida. Before we proceed with the primitive reflexes, do comment that you should complete your newborn screening by first performing a rib reflex by using a ophthalmoscope. Offer to check the vital signs of the baby, especially saturation, typically done on the right upper limb and the left lower limb. And also comment that the baby hearing should be screened via autoacoustic emission. The second part of the examination would be primitive reflexes. For undergraduate level, there are in total 4 primitive reflexes that you need to routinely examine. Number 1, rooting reflex. Simply stimulate the baby's sucking by gently flicking onto the angle of the mouth, and if the rooting reflex is present, the baby's face would turn towards the direction of stimulation. Next, sucking reflex. Again, insert your clean finger onto the mouth and gently stimulate the palate. That will stimulate the baby to suck the finger A good sucking reflex is both strong and sustained. Next, grasp reflex. Place both your fingers onto the palms of the baby, and if this is present, the baby will grip the finger rather tightly and spontaneously. Lastly, Moro reflex. Gently lift the baby, and with your hands supported on the neck and the buttock. And when the baby is sitting up, gently flex the neck and drop the baby in a secure but sudden manner. I repeat. Okay. A positive Moro reflex would be that of a symmetrical extension and adduction of both the upper limb, followed by flexion, and the baby would typically cry after Moro reflex. There are a number of other primitive reflexes as shown in the next slide.